Hello everyone, today I'm going to make a return demonstration on foot care. So for the assessment, we're going to assess for the skin surface, the presence of edematous or tenderness, circulating status, usual foot care practices, and self-care abilities. So the possible nursing diagnosis for this return demonstrations are risk for infection and impaired skin integrity. So the materials that we are going to use are water basin, pillow, waterproof pad, towel pad, washcloth, nails, cleaning and trimming equipment. Prior to performing the procedure, we are going to introduce ourselves and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can cooperate. So good afternoon, ma'am. My name is Desiree Archerona. I am your student nurse for today. So, pwede mo tanan sa full name, ma'am?
I am Hazel M. Takam,
Ano sa iyong birthday, ma'am?
September 2001.
Check na ako sa iyong reset mo. So, today, ma'am, I'm going to perform a foot care sa iyong kwan. So, kung hugasan mo tayo, ma'am, as per the doctor's order. Would that be okay, ma'am?
Okay.
We're going to do this procedure to avoid errors such as doing the procedure to the wrong client or going to the wrong client. Next is we are going to perform hand hygiene and observe other appropriate infection control procedures. Then we are going to provide for client privacy by drawing the curtains around the bed or closing the door to the room. Some agencies provide signs indicating the need for privacy. This is to reduce anxiety between the patient. Since the curtains are already closed and also the doors, we're going to proceed to the next procedure, which is to gather all the required equipment, fill the wash basin with warm water at about 40 degrees Celsius to 43 degrees Celsius, or about 105 degrees Fahrenheit to 110 Fahrenheit. Then we are going to assist the ambulatory client to a sitting position in a chair or the bed client to a supine or semi-faller's position. So, we're going to mag-sit. So, assist. Good. 1, 2, 3, go. Then we're going to place pillow under the client's knees. This is to provide comfort for the patient. Then place the wash basin on the moisture resistant pad at the foot of the bed for a bed client or on the floor in front of the chair for an ambulatory client. Then place the wash basin on the moisture resistant pad at the foot of the bed for a bed client or on the floor in front of the chair for an ambulatory client. For a bed client, pat the rim of the wash basin with a towel. Now we are going to proceed to the performance phase. First is to wash the foot and soak it. So ma'am, akong i-wash and soak yung katil, clear si ma'am. Place one of the client's feet in the basin and wash it with soap, paying particular attention to the interdigital areas. Prolonged soaking is generally not recommended for diabetic clients or individuals with peripheral vascular disease. Katsot bi, lo mo ni.
Bubukan ni mo. Ay, ano ra oh?
Nyo,
Ewan na yan na.
sige cut bi. Cut. 1, 2, 3, play. Place one of the client's feet in the basin and wash it with soap. Paying particular attention to the interdigital areas, prolonged soaking is generally not recommended for diabetic clients or individuals with peripheral vascular disease.
Otro, ayaw kayo si, ano, kilo kayo. Again.
Bula. 1, 2, 3, go. Place one of the client's feet in the basin and wash it with soap, paying particular attention to the interdigital areas. Prolonged soaking is generally not recommended for diabetic clients or individuals with peripheral vascular disease. Then rinse the foot well to remove the soap. Rub the callous areas of the foot with the washcloth. If the nails are brittle or thick and require trimming, replace the water and allow the foot to soak for 10 to 20 minutes. Clean the nails as required with an orange stick. Then remove the foot from the basin and place it on the towel. Dot the foot gently with a towel to dry it thoroughly, particularly between the toes. Then apply lotion or lanolin cream to the foot but not between the toes. Ako apply lotion yung ma'am. Okay sa inyo, ma'am. Apply a foot powder containing a non-irritating deodorant if the feet tend to perspire excessively. Cut. The next.
Ano naman nilas?
Ang pamanggod.
Ano ka butaan mo powder?
Ano ayaw no?
Okay.
Lang. 1, 2, 3, go. If agency policy permits, trim the nails of the first foot while the second foot is soaking. See the discussion on the nails for the appropriate method to trim nails. Note that in many agencies, toenail trimming requires a primary care provider's order or is contraindicated for clients with diabetes mellitus, toe infections, and peripheral vascular disease, unless performed by a podiatrist, general practice physicians, or advanced practice providers such as nurse practitioners. Then we are going to proceed to the follow-up phase. In the follow-up phase, document any foot problems observed. Foot cure is not generally recorded unless problems are noted. Record any signs of inflammation, infection, breaks in the skin, corns, troublesome calluses, bunions, and pressure areas. This is of particular importance for clients with peripheral vascular disease and diabetes. Evaluation. Inspect the nails and skin after the soak. Compare to prior assessment data. Report any abnormalities to the primary care provider. This procedure is going to improve the care for a patient and to ensure the patient's safety for those patients that have peripheral vascular disease or diabetes by ensuring that there are no complications within their foot. And that would be all. Thank you.